Hello and welcome to an English SP class.
Class time.
My name is Eric.
And I'm Rusty.
Today we're going to be going over just some vocabulary that we use when talking about hospitals and going to the hospital. So we're going to go over some vocabulary when you have a medical emergency, when you have to go to a hospital.
And to get there, you're going to have to get in. Sometimes, if you're in an accident, you need an ambulance.
Yes, you got to take an ambulance
Woo!
to get to the hospital
To
hopefully see this crazy bastard to help
doctor. Pull your pants down. Bend over.
you. And that is the doctor.
Yes.
And when you get there, you're going to see a whole bunch of kind of staff. In the ambulance, on the way to the hospital, the people that help you out there are the paramedics.
Yes.
It's these guys.
When there's an accident on the highway, people wait for the paramedics to arrive.
Yes, they're everybody's friend.
Hopefully tonight we won't drink too much and have to call for the paramedics.
No. And if you have to go to the hospital, you are the patient.
And in some waiting rooms, you have to be patient.
Yes. Yes. The waiting room, obviously, is the place that you wait until they can finally help you.
And if you have no insurance, you wait forever.
Yes, indeed. So there's a difference between inside the hospital, you have the doctor and a surgeon. All surgeons are doctors, but not all doctors are surgeons. Yeah. So only a few of them will cut you open. And then there's the nurses, who nurses are classically, I think, thought of as women, but nowadays nurses can be men.
Yeah, the male nurse.
And there can be female doctors.
Yes. Times have changed. Way to go, girls.
Playing with the gender roles, nice. So when you're in an ambulance and you're hurt and you're flying to the hospital and there's going to be this sign called emergency, you're going to the emergency room.
Yes. And they're going to attend you there and see how serious you are. And if it's a very serious problem, you might be sent to
The ICU.
Intensive Care Unit.
Yes, that means you might die.
Yes.
And this is where they're really watching you.
Yeah, you're under 24-hour surveillance there.
Yeah.
It's touch and go.
But hopefully you get out, and on the way out, they'll send you to the pharmacy.
Ah, yes, to get some drugs.
Yes, the pharmacy is always nice. And the person that works there is a pharmacist. End of July, you'll be going to the maternity ward.
Yes, I can go to the maternity ward, specializing for pregnant women who've just had babies.
Yeah, delivering babies. You will be in the cafeteria, maybe?
Yes, I'll be in the cafeteria having a coffee.
These are the places, and here's some common terminology. Typically, you're in there, you got to have an operation.
Getting operated on.
Or surgery.
Oh, surgery sounds scary. I'm going in for surgery. But you can go for
Yeah.
day surgery.
Yeah, if
Something light, you know?
you're in and you're
You're
out.
out.
In the same day, it means you're an outpatient.
Mm-hmm.
You're out very quickly. Versus an inpatient, which is a patient that has to stay one or more nights.
Yeah, you don't want to stay too long, yeah.
Yeah. While you're there, you'll often have to have a lot of exams where the doctor tests you.
Yeah, here in Brazil, I've been to, you go to one doctor and then they set up a bunch of exams at all different kinds of hospitals. So you seem to be getting thrown around to 3 or 4 different places to get that exam, to do the final.
Yeah, so exams, those are the tests. Any kind of test is an exam, although an x-ray is where they look at the bones.
They take a picture.
Once the doctor looks at those, they're going to come back with a diagnosis.
Like Dr. House comes in with these really rare cases, yeah.
He has that little epiphany.
Yeah. Oh.
Yeah.
And sometimes you need to go in just to get a shot.
Yes, a shot. They use this syringe and give you a shot of medicine.
Normally in the butt.
Yes, in the bunda or the arm.
IV drip.
Yes, an IV drip is this thing here, where they attach it to you so you can get some liquids.
Yes, because I was so dehydrated.
So that's the IV drip, and I think anesthesia is the same in Portuguese. It's the stuff they get to numb the pain so you have no feeling. But there's two kinds. There's general anesthesia, which is the kind that puts you to sleep.
Yeah, the mask over your mouth.
Yeah, and you count backwards from 10, 9.
Yeah, and then there's the local.
The local.
Just a little needle to numb the area around where they're going to do the surgery on.
Yeah, a lot of dentists will use local anesthesia to numb your mouth. And some words that are common when talking about hospitals, talking to doctors. The first one is hurt or pain. Which word do you use when?
Sometimes the doctor, when you enter the office, he might say, "Okay, show me or explain to me where it hurts."
Yeah.
Where does it hurt?
Hurt is a great word because we can use it as a verb or an adjective.
Yes.
So you could say, "Hey, doctor, I hurt my leg. I hurt my arm."
Or my leg hurts.
Or my pride hurts.
You hurt my pride.
Yes. Versus pain, which is a noun.
Yes. I'm in pain.
I'm in pain. I have pain in my leg.
No pain, no gain at the gym.
Very true. Very true. I have no pain. Therefore, I've been making no gains. Yeah, so pain is a noun. Hurt is a verb or adjective. We also have ache or sore.
Yes, you have my stomach aches, my back aches. It's like a continual pain, yeah?
Yeah.
Throbbing or
Yeah, it's an ongoing pain. Ache can be a verb. It can be a noun.
Mm-hmm.
It can be an adverb.
What kind of an ache do you have?
I have a headache.
A stomach ache.
Stomach ache. My head aches.
My back still aches
Yeah.
when I hear that word.
I ache for bacon.
Heartache. Heartache
Versus
tonight.
Sore.
The Eagles. Come on.
Sore is it means it's sensitive. I have a sore throat. It's just really sensitive. Like if I eat something, it really hurts. Or
Sometimes sore to touch. If you touch it, it's sore.
yeah, if you spend a lot of time in the sun, if you touch your skin, it's really sore. Don't touch my skin.
Sore can also be a noun, like an open sore in your skin, or
Yeah, those are gross.
you have a lip sore, like herpes. Yeah.
Ew.
Yes.
Disgusting.
Stay with you for life.
The next area we got broken or fractured. So, really, technically, everything is a fracture.
A certain part of your bone is fractured.
Yeah, so like every single thing here you see is a fracture and a kind of fracture. From a hairline fracture, which is very small, to this all the way separated. Normally, when this kind of thing happens, we say, "I broke my arm," instead of saying fractured. But fractured refers to all of these things in medical terms. And finally,
Heart attack.
heart
Or
attack.
cardiac arrest and a stroke. All things to do with blood.
Yeah, a little bit different each one. Heart attack being that the blood flow to the heart stopped, or maybe something was in the veins. You ate too much salt. You had a blood clot, and so the blood stops to the heart. You have a heart attack. Not enough blood to the heart.
The cardiac arrest.
Cardiac arrest is basically the heart stops beating. You know, like in the movies where they got the two things. They go clear, and they have to use an electrical shock to restart or to stimulate the heart into working again.
CPR.
Yeah.
CPR. Administrate CPR. And a stroke when the blood doesn't make it to the brain.
Yes.
That can cause people to be paralyzed, yeah?
Yeah, so be careful with your sodium intake.
Your cholesterol.
Yeah. Take care of yourself. Do some exercise. Get to the gym.